Hi, my name's Matthew Links and I'm the Discipline Lead for Medicine, Bond University on the Gold Coast, land of the Combermere people, and a medical oncologist and survivor of working in clinical practice for the last 30 years. Today I want to share with you a structure for a meditative and reflective practice when you're feeling sad. In my practice, this may be because a patient I'm caring for has died, or I'm distressed by some other aspect of their suffering. I'm going to introduce the topic for 5 minutes and then lead a guided meditation for about 10 minutes. The idea is that if you've got the structure, the video and guided meditation become redundant and you can guide yourself. If you want to, you can skip to the meditation by clicking on the information symbol in the right corner. The framework we'll use is called RAIN. It comes from the work of Tara Brach and others. It's recognition, acceptance, investigation, and nurturing. And after the RAIN, you should have a little set of statements or mantras that you can use for a mini RAIN practice that you can use in 30 seconds during the day if your distress returns. You should also leave with an intent about what you want to do as you go out into practice to look after yourself. You'll be asked as we go through the video to remember and repeat these mini RAIN statements. If you like, write them down as you go. Dealing with suffering is hard, and there's a lot of suffering in medical practice. It's a product of the way modern society has structured work, that we put humans in extreme situations. Think about a tennis player requiring a shoulder reconstruction in their 20s, or the football player with a repeated concussion, or the impact for you on your mind of being exposed to so much death and dying. Finding a way of processing suffering is a key skill. There are a number of strategies that you can use to deal with suffering. The great religious traditions have offered approaches to these questions. Positive psychology has explored what it means to thrive and the importance of gratitude, meaning, and connection. Modern psychology has demonstrated benefits to mindfulness, acceptance, for example, in acceptance and commitment therapy, and challenging the way we frame our understanding of problems through a cognitive behavioural approach. Dealing with suffering is not about the power of positive thinking, banishing sad thoughts, but it's about mindfulness, acceptance of what we're feeling, finding ways of reframing the ways we're thinking, and connecting to strategies that nourish us. So this practice is aimed at processing the everyday suffering that we're exposed to. If revisiting this suffering causes you distress, try and sit with it, but if it's too much, you can always stop. Of course, if you find you're exhibiting sadness that's more consistent with a clinical depression or symptoms of anxiety or thoughts that are more intrusive, or if self-help's not working for you, I'd strongly encourage you to reach out for professional help. So to do this meditation, you should select an incident of a patient's suffering that's impacting on you. Try and think of an image that represents this for you. So with that, let's begin. Find a quiet space and a position that's comfortable for you. Let's start by anchoring our breath and taking a deep breath in and out. Focus your attention on your breath, breathing in and out. In and out. Now, if you find your attention wandering through this practice, just acknowledge those thoughts, wave them goodbye, and return to your breath and then the guided meditation. So breathe in and out. Bring to mind now the incident of suffering that you want to work with. Recall the image that summarizes it for you. Notice how you feel. Where do you feel this in your body? Sit with this feeling, recognize it. This is what sharing suffering feels like. Do you feel sad? Do you feel compassion? Do you feel angry about the unfairness of it all? Just notice. Breathe in and out. Now pick a recognition statement. Whatever works for you. I'm sad, or I'm upset about this, or this makes me angry. And as we take a few more deep breaths in and out, just repeat your recognition statement as you breathe in and out. Now we're going to focus on accepting the way you're feeling. It's okay to be distressed. It's okay to be sad or angry. You might reflect that your experience of these emotions is caused by the fact you care. If sharing suffering with our patients doesn't impact, then perhaps something's wrong. Pick an acceptance statement. It might be, it's okay to be distressed, or I'm distressed because I care, and that's okay. Whatever works for you. Take a few more breaths in and out. And focus on acceptance. In and out. Next, we're going to investigate the underlying cause of your distress. Is there a reason why this patient's suffering is impacting on you particularly? Are there buttons being pushed for you? Is it because they remind you of someone in your life, a parent or yourself? Is it because there are some feelings of guilt or blame about the outcome? Is it because it's unfair? And what are your expectations? What did you expect would happen? And if appropriate, challenge those expectations. Not all treatments work. People die. People die from the side effects of treatment we've given them. Life's not fair. Suffering's inevitable. Next, think about the compassion you showed in this situation. Perhaps it was hard to be there, but you were present for that patient, for that family. Think carefully about whether there's anything you can be grateful for in that encounter. A moment shared, gratitude expressed, the support of the team for each other. Remember, it is a privilege to be present as a doctor at a critical time in a patient's life. What can you be grateful for? So now select an investigate statement that reflects a way of thinking and understanding what happened that's helpful. Keep that statement in mind and just repeat to yourself as you breathe in and out. In and out, repeating your investigation statement. And next, we're going to focus on nurturing yourself. What are you going to do to look after yourself in response to this stress? Is there a self-care strategy you need to connect to? Are you going to connect with other team members who've been exposed to the same suffering? There's great strength in being able to deal with these situations together. Are you going to talk it over with a senior and explore their wisdom about how they cope with this stress? Is there a ritual that you can use? Sending a card to the family, spending some quiet time being grateful for what you've witnessed and the experience you've shared. Creating your own rituals to remember patients who've died is a powerful way of processing. Select a nurturing statement that indicates what you're going to do to look after yourself out of these or other options. And as you breathe in and out, just repeat that nurturing statement to yourself. As you breathe in and out. Now, as we bring this meditation to a close, you should have a series of statements that are your mini rain. And it may be something like, this death particularly distressed me. It's okay to be distressed. I understand death is inevitable, no matter how hard we try. And I'm going to go for a run after work, and while running, focus on what a privilege this has been. Repeat your mini rain statement as you breathe in and out. And notice how you're feeling now. Has it helped? And if there's a sense of peace, connect to that sense of peace. And remember how that feels. Now, sometimes when we've experienced a trauma, thoughts come back to us during the day. And if during the day you find yourself coming back to this incident, run through your mini rain and connect to the solution, to the process that you have developed. And finally, let's identify an intention that arises from this experience. What happens after the rain? What are you going to do? You might commit to being present even when it's hard. You might commit to nurturing the compassion you showed, or to improving your skill at pain relief or breaking bad news, or whatever it was that made this difficult. Identify an intention on how you're going to use this incident to go forward and continue caring. And as we breathe in and out, just repeat this intention to yourself as we prepare to go back into the world after this meditation. So I hope you found this meditation helpful and that you can develop a practice of dealing with suffering that sustains and nourishes you so that you can go on caring for those that we serve. Thank you for committing your time to this wellbeing practice. If you'd like to find out more information, have a look at our Vimeo or YouTube channels. And if you'd like to find out more about RAIN, I'd recommend you visit Tara Brach's website and the links to her book, one of her books, such as Radical Compassion. And if you like this video, please like it. We'd love to hear your comments or requests for further content. Take care.